The content of this animation is intended to support people who know a young person experiencing low mood and depression. It may trigger some upset or distress. Be mindful of your feelings and keep yourself safe. Depression is a mental health condition that affects your mood. Feeling low is natural, and often the symptoms are short-term and we can work through them over time. But sometimes we can get stuck or feel down and stop enjoying things for weeks, months, or even longer. When we become stuck in a period of low mood for 2 weeks or longer, it could be a sign of depression, and it can affect different aspects of our lives. Symptoms of general low mood in children and young people may include feeling sad, anxious or panicky, more tired than usual or being unable to sleep, angry or frustrated, less confident or with low self-esteem. A low mood often gets better after a few days or weeks. However, if these feelings persist, the child or young person could be experiencing depression. Symptoms and characteristics of depression may include feeling hopeless, struggling to concentrate on everyday tasks, struggling to get any enjoyment out of life or not being interested in things they used to enjoy, experiencing suicidal thoughts or thoughts about harming themselves, eating less or more than usual. This may lead to a significant change in weight, feeling unable to relax or being more lethargic than usual, feeling empty or unable to feel emotions, withdrawing from social events or isolating themselves, misusing alcohol or other substances, complaining of physical pain such as stomach aches or headaches, being tearful and crying more than usual. It is important to be mindful that depression can coexist with other mental conditions such as anxiety. Depression can also go undetected in young people due to coinciding hormone changes and normal adolescent behaviour. Why might children and young people develop depression? We may not know why children and young people get depressed, but sometimes there are some obvious risk factors. Depression can be triggered by a difficult event, such as bereavement, parental separation, or problems in school. Often it is caused by a mixture of circumstances. Things that increase the risk of depression in children and young people include family difficulties, such as parental separation, negative life events, such as global pandemics or bereavement, bullying, physical, emotional, or sexual abuse, a family history of depression or other mental health problems, relationship difficulties, trauma, past or present. What can parents and carers do to help? Whether you know the cause of the problem or not, take it seriously. Things may not seem significant to you, but it could be causing major distress for your child or young person. Open up the conversation. Try using sentence starters like, "I've noticed you don't seem very happy." This voices your concern in a caring, non-judgmental way. If your child does not want to talk to you about their feelings, let them know that you're concerned about them and that you are there if they change their mind and that you're on their side. Encourage them to speak to someone they trust, such as someone at school, a family member or friend. Provide emotional support as opposed to trying to fix the problem, and avoid asking too many questions. It may be helpful to contact their school or ask if they have any concerns and discuss how they might be able to support your child or young person. Children and young people often find communication difficult, so consider talking to them over text or on the phone. Be patient and try to stay calm and approachable, even if their behaviour upsets you. Recognise that their feelings are valid, and let them know it's okay for them to be honest about what they're feeling. Encourage healthy activities, such as being in nature, exercise, breathing exercises, or mindfulness. Be a role model by taking care of yourself and openly talking about your feelings to show them that it's okay to do so. Try not to blame yourself about how they are feeling, and remain hopeful of their recovery. Celebrate achievements. Keep to daily routines. If you think your child or young person is depressed, or you're concerned for their general well-being, take them to the GP who can suggest further support. Remember, you are doing the best you can in the context you are in. They are doing the best they can in the context they are in. Recovery is possible. You are not alone. There are lots of local and national support services who can guide you and support both you and your child or young person. Do not hesitate to seek support. Everyone deserves help.